Welcome once again to SoCo Chat, a podcast where we hear directly from county leaders, discuss the latest news, and talk about all things concerning our beautiful corner of California known as Sonoma County.
Welcome to SoCo Chat. I'm your host, Matt Brown, Deputy Communications Manager for the County of Sonoma. Thank you for joining us. Today, we're happy to share an interesting and unique project from the Sonoma County Department of Health Services Public Health Division. It's a rollout of new vending machines, but you can't get a Kit Kat or a bag of Doritos from these vending machines. Instead, they contain important health supplies like the opioid overdose reversal drug Narcan, fentanyl test strips, condoms, and pregnancy tests. Joining us to talk about this initiative are Ryan DeHart, Public Health Preparedness Section Manager, and Alyssa Hamilton, Public Health Analyst. But before we get to our interview, here's our trivia question for the week. What are the locations of the first 3 vending machines in the Sonoma County Public Health Vending Machine Project? Here's a hint. If you listen to this entire episode, you'll likely hear the answer. If you know the answer, call us at 707-565-2242 or email us at publicaffairs@sonoma-county.org. If you're correct, you'll be entered into our drawing to win a SoCo Chat coffee mug. So with that, let's move on to our discussion. Ryan, Alyssa, thank you for being here.
Hey, thanks, Matt.
Thank you for having us.
Absolutely. So first off, tell us a little bit about this project. Why is the county launching these vending machines?
Yeah, so this project came out of COVID. During the latter part of COVID and towards the end of the response operation, we were really trying to figure out a way, how can we get COVID-19 at-home tests within the community? And we wanted to be able to do so in a way that we weren't doing already. We wanted to have it be a little bit more accessible to the community, and so we thought about the idea of vending machines. That might be a possibility of how we can better serve and be able to distribute those. And after conversations with the Healthy Communities and Family Group, we had a couple of different items that we realized, hey, this is something that we can also stock within these machines that ultimately benefit the health of the community, do harm reduction. And we didn't want to limit ourselves just in terms of just one item. We wanted to expand that to be a whole multitude of different items within there.
Absolutely. Well, let's talk about those items. So in these initial vending machines, the list of items includes Narcan, as we said, condoms, fentanyl test strips, hygiene kits, dental hygiene kits, feminine hygiene products, pregnancy tests, COVID tests, as you mentioned, socks, cable gun locks. How did you choose these particular items?
Well, all of these items are evidence-based practices. And so when we were looking at this program and how to design it and how to come to these products, we're looking at lowest resourced areas. And so people's accessibility to these common health, wellness, harm reduction, evidence-based resources. And so that's kind of what drove and guided us for the pilot phase of what to start with. And then our hope is to expand to better meet the needs based on feedback.
So you could really add to these machines if you want, right? Add other products, anything you want in there.
Absolutely.
Yeah, as Alyssa mentioned, these are evidence-based practice items. We also want to acknowledge that there are certain items within here that will ultimately, help positively benefit the community, and ultimately, with the tragedies that we've seen recently with 2 teenagers in Santa Rosa overdosing on fentanyl. Things like Narcan will help to hopefully mitigate against those types of tragedies happening in the future.
Absolutely. Well, these are really important products to get to people. Where can people find these vending machines if they're interested in utilizing these resources? Where are the initial 3 located?
Yeah, so as I had mentioned, this is our pilot phase. And so we have 3 machines. The first one is located at Russian River Health Center out in Guerneville. And then we have Santa Rosa Junior College in the Student Center is the second location. And then the third location right now, which is a temporary location, is at the Public Health Department offices off Aviation Boulevard, with the hope of that one moving to North County soon.
Okay. How did you choose those locations?
Yeah, that's a great question. So, I love data. So looking into Healthy Places Index measure, which is comprehensively looking at across our county where are the geographic areas that are the lowest resourced, and then also looking at where are we seeing clusters of opioid overdose deaths in our county. And then so after looking at both of those measures, that is really what drove where we need to start looking to building partnerships in certain geographic areas across our county for placement.
Interesting. So how does one engage with these vending machines? Do I walk up? Do I have a bag full of quarters? Do I have to stick quarters in there? Do they take dollars, credit card? Is there a cost at all to this? How does someone use these machines?
Yeah, so it operates more or less like a standard vending machine. There's an iPad-like interface in the front, and to answer your question, there is no cost to them, to the consumer themselves. The intention behind this is to try and break down that barrier there. There's a couple of demographic questions that we ask, age range, prior unhoused status going into accessing the vending machines themselves, and things that help us get better identifiable information for what type of individual are accessing these products. It's confidential. You don't have to put your name or any personal identifiable information within there, but it helps us to kind of drive where we may want to post some of these vending machines in the future, and ultimately who's trying to access these types of programs.
Interesting. And just curious, if there's no cost to it, how do you stop someone from coming and taking all the supplies at once? Or, there are some valuable items in here like gun locks. How do you stop someone from taking all of those and selling them later or something? What's the way to do that?
Yeah, so we definitely thought about that going into the design of the program. And so luckily, with the technology of vending machines nowadays, you can we have elected to limit each transaction to 3 items. So individuals can go back to the machine as many times throughout the day, the week, the month, however they want. But at each individual transaction, they can choose up to 3 items. And so what's really interesting is right now we haven't seen abuse of that. Hopefully that isn't the case. But right now people are averaging 2 items per transaction. So that's exciting, I think, for me to see that there is a need and people are happy with what is available at the present time.
Great. And you're restocking these as needed, I assume, and putting more items back in there?
Yes, yeah, we have a great team of community health worker in addition to ourselves, and the community health worker is going out once a week to restock all of these machines. And as we expand the program, I would anticipate that increasing as demand increases as well, which is exactly what we want.
Great. How are you reaching out to the people that could benefit from these items, letting them know where they are and letting them know that they're available?
I want to just highlight, as mentioned, this Community Health Worker CHW program. It's a program that we have within health services that has individuals that go out and engage with populations that are underserved within the community. We're working with that group to be able to advertise this, let people know what the supplies are that are currently within these machines, and then also hours of operation, where they're located, those types of things. We've been really fortunate to have the partnerships that we have for this project, not only in terms of placement and the sites, but also in terms of advertising this and getting the word out to the constituents and people that they serve within their organizations as well, on top of just regular media. These types of podcasts are a great opportunity for us to be able to talk about this program and trying to get out in the press the information regarding this.
Yeah, well, the rollout seems to have been going well. I know you did get some good media coverage out of this, right?
Yeah, we did
Absolutely.
a couple. Yeah, so
I think more than what we thought we would get.
yeah, a lot of
So
interest.
it's a huge
and,
win.
Yeah, a lot of interest. We've been very happy so far with the level of interest from the community.
Is this a unique project to Sonoma County? Are there other counties doing this or other public health agencies that have done something like this? Do you know of?
Yeah, so actually a little history lesson. So back in 2016, Nevada launched the first machine. This idea was conceptually overseas. And as Ryan had mentioned, COVID kind of just really kicked off people thinking about how do you engage with the public? How do you bring services to the public in more non-traditional manners? And so there are numerous counties across California and the U.S. that have some version of this program. But what you'll see is the variance in the type of offerings. And that's why we feel ours is so unique for Sonoma County, is really trying to address the needs of our residents, so that we can really change and prevent negative health outcomes.
Yeah.
And to that point too, one of the things I think that's unique about our program is that some of the supplies that we get and that we've opted to put into these machines come from these types of partnerships. For example, cable gun locks came from a partnership that we have with local Veterans Affairs. They have their own campaign for harm reduction, specifically for gun violence and suicide prevention. Those types of things lead to us being able to get supplies of those gun locks from them to be able to supply the machines themselves, but also encourage their message within what we're trying to do as well.
Tell me a little more about the, especially the Narcan that's in there. I know that that's a very valuable, important intervention for people that are having, experiencing an overdose for opioids. Why is that so important to get out there into the community? It's not just in these vending machines. I know other people are trying to offer Narcan in public places as well, right?
Yes, absolutely. I mean, it's critical because it can reverse an overdose, which means it can save a life. And so, it goes back to just really the heart of this project, which is about accessibility and availability. And when those two things live together, I believe that it empowers choice in an individual and gives them access to have a different outcome if that was not made available to them.
Yeah.
Yeah, I think that also the fentanyl test strips, I don't want to overlook that as well as a mitigation measure. Being able to test is paramount to knowing what you're doing as well and making an informed decision with whatever you're doing. I also just want to make mention that there is the Northern California in general. Most of the counties within our region have a higher opioid death per capita rate than the rest of California, and it disproportionately is impacting this region of the United States and of our state alone. Being able to offer this helps to combat what we're seeing already, and ease of access to that is incredibly important as well.
Yes, because it's unfortunate to see Sonoma County in particular rising above the state average when it comes to these overdose rates. So, I feel obligated. I think, we all have a part to play in helping change that for our county.
Absolutely. We're calling this is branded as Health to Go. Is that what you're calling it?
Yes.
That's a great name. And what are the plans to expand this initiative? We've got the 3 initial vending machines so far with the list of products that we mentioned. Is there any plans to provide more vending machines or more in different products in there?
Yeah, at this point, the goal is to expand to 4 additional, I should say, machines throughout the county. As Alyssa mentioned, we're looking at data where this is really driving where we're trying to focus this. Opioid death information and data rates, 911 for overdoses as well, and the HPI index as well. We're also looking for partnerships. We want to meet people where they're at within the community, and partnerships with organizations and businesses within different regions is something that we're really looking into and trying to recruit and maintain as part of this project as well. It's also important to mention too that we're looking to kind of expand to geographically different regions throughout the county. We want to place them so that those that are in lower HPI areas and maybe in higher affluent neighborhoods or areas can still access these without having to go farther away from where they're currently at.
Yeah, so an overall goal would be to have one of these machines in every district across the county. So we could cover our northern, southern, western, and east borders, and just make it accessible to everybody. And so, that's exciting. And as we look to build partnerships for funding and supplies, that'll really help allow us to expand this project.
It's also important to mention too, and I think it's important for those that are listening, we don't want to be insular from the county perspective or prescriptive in terms of what we stock within these supplies. Each one of our vending machines has a QR code on it that allows for individuals to give feedback to this project, including what they would like to see stocked within their region or things that they think would be helpful for future stocked for harm reduction or benefiting the wellness of the community.
Great. Alyssa, you mentioned funding. How is this project funded?
Yeah, so Ryan can help out with this too, but as he mentioned, it started with COVID-19 funds, which his program originally had. So he could kind of expand upon that and then
Yeah, of course.
see where we're going to the future.
Yeah, so COVID-19 funding, continuation funding post-COVID. Once the response ended, we were given continuation federal funding for COVID-19 projects, and this was part of that. Ultimately, that was impacted, and that was intended to be the long-term source going into July of 2026. Unfortunately, we had our funding cut by the federal government fairly recently, and we're really fortunate to have supplemental public health funds within the county to be able to cover this project. We're doing active recruitment right now from both federal, state pass-through funds to be able to continue this project from that perspective, but also, looking to different partnerships throughout the region for not only money to support this project, but also for the supplies themselves that we stock.
Yeah.
Yeah, so I think it's, despite what we've gone through, it's really challenged us to think about how do we engage in a non-traditional manner? How do we seek funds, look at foundations or donation programs for supplies, and just also identify partnerships that we've never had before that would be non-traditional? Because sometimes you forget about that when you're not forced into that situation.
Yeah, absolutely. Well, this is a great project. Is there anything else you'd like to mention about this project? Anything else the public should know about it?
Well, I would love to share, if I can look at my cheat sheet,
Yep.
I would love to share just some of the general stats that we have from the usage so far. So we launched these machines on the 4th of April. And as of yesterday, the 23rd, we have had a total of 281 transactions across all three of our machines, and which totaled to 532 items dispensed. So for being only 3 weeks out on the street, I think things are going really well. And we're just really encouraging people to continue to use the machines, use the QR code, let us know what items that you want. If the machines aren't meeting your need, let us know, because that's why it's here. We want to hear from you and we want to adapt accordingly.
I'd also just mention that this is for every Sonoma County citizen. We look at data to help drive for certain demographics, those that are potentially, at lower risk or higher risk or lower potentially, socioeconomic class or, those types of things. But I want to reiterate that this is for every individual. We encourage people to go check out these machines and access these machines. If you need a dental hygiene kit, if you need Narcan, if you need fentanyl test strips, if you need a cable gun lock, if you need socks, go access this program, these machines. It's for everybody within our county.
That's great. Well, this is a great project. We love sharing it, and we really love having you guys here to share it with us. So thank you so much, Ryan and Alyssa, for being here.
Yes, thank you for having us again.
Absolutely. As a thank you, would like to offer you a SoCo Chat water bottle or a coffee mug to take away. And to our listeners, we'd also like to give you the opportunity to win a SoCo Chat coffee mug. All you have to do is correctly answer our trivia question for today. Our question today is this: what are the locations of the first 3 vending machines in the Sonoma County Public Health Vending Machine Project? And as a hint, if you replay this episode, you'll probably hear the answer. So if you know the answer, give us a call at 707-565-2242 or email us at publicaffairs@sonoma-county.org. Also, if you have comments about this or any other episode or suggestions or topics for a future SoCo Chat episode, please email us at that same email address, publicaffairs@sonoma-county.org. Thank you all, and we hope you continue to follow SoCo Chat on Spotify, Apple Music, Amazon, and of course on YouTube. Thanks again, Ryan and Alyssa.
Thanks.